Good day, everyone. Today, I will be discussing the physical hazards or effects of alcohol, tobacco, and drugs on our body. Let's start with the physical hazards of alcohol on your body. Alcohol's impact on your body starts from the minute you take your first sip, while an intermittent glass of wine with dinner isn't a cause for concern. The increasing effects of drinking wine, beer, or spirits can take its toll. A glass a day may do a little damage to your overall health, but if the habit grows or if you find yourself having a hard time stopping after just one glass, the increasing effects can add up. Drinking alcohol can also harm your digestive and endocrine glands. Drinking too much alcohol can cause abnormal activation of digestive enzymes produced by the pancreas. Build-up of these enzymes can lead to inflammation known as pancreatitis. Pancreatitis can become a long-term condition and cause serious complications. Heavy drinking can also lead to gasiness, bloating, and a feeling of fullness in your abdomen, diarrhea, or painful stools. For people who drink heavily, ulcers or hemorrhoids, these are due to dehydration and constipation aren't uncommon, and they may cause dangerous internal bleeding. Ulcers can be fatal if not diagnosed and treated early. People who consume too much alcohol may also be at risk for cancer. People who drink frequently are more likely to develop cancer in the mouth, cancer in the throat, cancer in the esophagus, cancer in colon, or cancer in liver. People who regularly drink and use tobacco together have an even greater trusted source cancer risk. Alcohol intake can cause inflammatory damage. The liver is an organ which helps break down and remove harmful substances from your body, including alcohol. Long-term alcohol use interferes with this process. It also increases your risk for chronic liver inflammation and liver disease. The scarring caused by this inflammation is known as cirrhosis. The formation of scar tissue destroys the liver. As the liver becomes increasingly damaged, it has a harder time removing toxic substances from your body. Liver disease is life-threatening and leads to toxins and waste buildup in your body. According to the research, women are higher risk for developing alcoholic liver disease. Women's bodies are more likely to absorb more alcohol and need longer periods of time to process it. Women also show liver damage more quickly than men. Too much alcohol on your body can also affect your immune system. Drinking heavily reduces your body's natural immune system. This makes it more difficult for your body to fight off invading germs and viruses. People who drink heavily over a long period of time are also more likely to develop pneumonia or tuberculosis than the general population. About 10% trusted source of all tuberculosis cases worldwide can be tied to alcohol, breast, and colon. Now, let's move on to the physical health risks of smoking tobacco. In the United States, the research said that smoking causes about 20% of all cancers and about 30% of all cancer deaths. About 80% of lung cancers, as well as about 80% of all lung cancer deaths, are due to smoking. Lung cancer is the leading cause of cancer death in both men and women. Smoking also increases the risk for cancers like cancer in the mouth, larynx or the voice box, pharynx or what we call the throat, esophagus, kidney, cervix, liver, bladder, pancreas, stomach, and colon or rectum. It also raises the risks of acute myeloid leukemia. Cigarettes, cigars, and pipes can all cause cancer. There is no safe form of tobacco smoke. Smoking tobacco damages your lungs. Smoking damages the airways and small air sacs in your lungs. This damage starts soon after someone starts smoking, and lung function continues to worsen as long as the person smokes. Still, it may take years for the problem to become noticeable enough for lung disease to be diagnosed. Smoke damage in the lungs can lead to serious long-term lung diseases such as chronic obstructive pulmonary disease or COPD. Smoking can also increase the risk of lung infections such as pneumonia and tuberculosis. It can worsen some existing lung diseases such as asthma. How smoking tobacco affects your heart and blood vessels. Smoking tobacco damages your heart and blood vessels, or what we call the cardiovascular system, increasing your risk of heart disease and stroke. Smoking is a major cause of coronary heart disease, or CHD, in which the arteries of the heart can't supply the heart muscle with enough oxygen-rich blood. CHD is the main cause of heart attacks and it's the leading cause of death in the United States. Smoking causes high blood pressure, lowers your ability to exercise, and makes your blood more likely to clot. It also lowers HDL cholesterol levels in the blood. All of these are risk factors for heart attacks and stroke. Smoking is a major risk factor for peripheral arterial disease, or PAD. In PAD, plaque builds up in the arteries that carry blood to the head, organs, and limbs. This increases your risk of heart disease, heart attack, and stroke. Smoking increases the risk of having an aortic aneurysm. This is a balloon-like bulge in the aorta, the main artery carrying blood from the heart to the other organs. It is caused by a weakening of the wall of the aorta. Aortic aneurysms can grow larger over time, and they can build life-threatening if they rupture or break open. Smoking can cause or worsen poor blood flow to the arms and legs, which is called peripheral vascular disease, or PVD. This can lead to pain in the legs when walking and may lead to open sores and don't heal. Because smoking affects blood flow, it can lower your body's ability to heal from cuts. This is why many doctors won't do certain operations on patients unless they stop smoking. There are other ways smoking tobacco affects your health. Smoking can affect a person's health in many other ways, harming nearly every organ in the body. Here are a few examples of other ways smoking tobacco can affect your health. Smoking tobacco can increase risk of gum disease and tooth loss, lowered immune system function, increased risk of type 2 diabetes, decreased sense of smell and taste, premature aging of the skin, bad breath, and stained teeth. Smoking tobacco can also lower bone density or thinner bones, which means a higher risk for broken bones including hip fracture, higher risk for rheumatoid arthritis, increased risk of cataracts, clouding of the lenses of the eyes, increased risk for age-related macular degeneration, which can lead to blindness, and wounds taking longer to heal. Many of the health problems linked to smoking can lower a person's quality of life. Smoking-related illness can make it harder for a person to breathe, get around, work, or play. Quitting smoking, especially at younger ages, can reduce smoking-related disability. How smoking tobacco can affect children and teens. Cigarette smoking and the use of tobacco products can cause health problems in the children and teens. Over time, these can include the serious health problems discussed above, which might start at even younger ages. One of the most serious problems is nicotine addiction, which often leads to long-term tobacco use as kids get older. There is also some evidence that nicotine harms the brain development of teenagers. It is important to know that most e-cigarettes and similar products also contain nicotine. Children and teens who smoke regularly tend to have more health problems than kids who don't smoke, such as coughing spells, shortness of breath even when not exercising, wheezing or gasping, more frequent headaches, increased phlegm or mucus, respiratory illness that are worse and happen more often, worse cold and flu symptoms, reduced physical fitness, and poor lung growth and function, which increase the risk of COPD later in life. Now, let's move on to the effects of drug abuse on physical health. Side effects of drug addiction may include a weakened immune system, increasing the risk of illness and infection, heart conditions ranging from abnormal heart rates to heart attacks, and collapsed veins and blood vessel infections for injected drugs, nausea and abdominal pain, which can also lead to changes in appetite and weight loss, increased strain on the liver, which puts the person at risk of significant liver damage or liver failure. Side effects of drug addiction also include seizures, stroke, mental confusion and brain damage, lung disease, problems with memory, attention, and decision making, which make daily living more difficult. Global effects of drugs on the body, such as breast development in men and increases in body temperature, which can lead to other health problems. Drug abuse can also cause dangerous health issues like lung or heart disease, stroke, cancer, infections like HIV, hepatitis, and AIDS. Drug abuse can adversely affect every major system in the human body. Teens who abuse drugs may engage in behavior that places them at risk of contracting HIV, AIDS, or other sexually transmitted diseases. This may happen because they are injecting drugs and sharing used needles, or because of poor judgment and impulse control while experiencing the effects of mood-altering drugs, making them more likely to engage in risky sexual behaviors. It can also cause or worsen mental disorders like anxiety, depression, and schizophrenia. That would be all. Thank you.